We all want everybody to have a good death, a good journey at the end of their life.
And I think this organisation facilitates that.
It's giving people the tools to help them provide better end-of-life care.
When medical professionals say to me, I've seen things in a new light, I'm going to work differently from now on, I feel that's actually making a difference.
I think that NCPC makes a difference because it allows people to access information that they wouldn't otherwise be able to do.
The pamphlets and booklets that they publish are really useful to people out in the field.
Without the facts about what you can expect at the end of life, how can you get the best for them?
And they can give me guidance where I don't know where to turn. They can help route me to the right place.
I guess that's one of the things the organisation represents for me, choices and difference, and just like a space to discover how other people manage the impossible.
NCPC, I think, have opened the whole subject up and said, it is okay, you have permission to talk about it.
They work with service users like myself to really try and get that voice heard.
They're taking it out to different organisations involved in dying, such as hospitals, to Parliament, so that it's not something that can be dismissed.
If we want to improve it, we have to have it on the agenda. So I think now it's on the agenda in a way it never has been before, and that's the way we'll actually make progress and change things. Our son Neil died 4 years ago, and since that time I've been reflecting on what worked well during his final illness but what didn't work well. Our agenda for change was very much the same as National Council for Palliative Care, which is why we're glad to support them.
My wife and I had a fairly good experience with palliative care. I want to make sure other people have the same thing.
I'm really excited about helping other people to have a positive experience of end-of-life care.
I need to validate Neil's life. I need to know that it's making a difference to people.
I speak to nurses, doctors. I recently got asked to do a talk on breaking bad news for trainee GPs.
We run a drop-in for local people to come in and offload their anxieties about the end-of-life care.
Having input to literature.
We've run several local events. We've been out in the shopping centre giving out leaflets and information packs.
I'm always talking about end-of-life care in different surroundings.
To tell them what it's like for me.
People would cross the road because they think, oh God, I can't, you know, she's going to talk about it. Do you know what I mean? And it's so to be able to pass on a message to say it hasn't got to be like that.
It's okay to talk to you because it's an on-limit subject for you. And I think a lot of what NCPC is doing is actually giving people permission to talk about something that's really important to them.
Just being able to communicate with another human being that's had a similar experience as you can be really valuable.
Most people actually do want to talk, but they can't find the arena to talk in. Since I've become involved with NCPC, so many people have phoned me up or just met me and said, Tony, I need to talk about this.
But being involved with the National Council for Palliative Care has given me a meaning to my life.
It was like a light went on and I thought that's amazing.
It's a very varied experience.
It's helped me make an awful lot of friends and realise that I'm not on my own. And I've also met a lot of very distinguished professionals, which I feel very privileged to have done.
NCPC are the people who said you can talk to professionals, you can make things happen, you can make a difference. And it's taken me places I couldn't dream of.
You know, up until 4 years ago I'd never sort of spoken at conferences, and now I have no problem with that at all.
I'm feeling my confidence has grown and I'm feeling useful. I'm feeling I'm making a difference to somebody.
So I think they see things in me that I didn't know were in there.
I recently received an MBE for my work, but I feel it's not my MBE, it's NCPC's MBE.
I like their openness to inviting new people in from all sorts of walks of life and with a huge range of different experiences.
I've had that life experience. So I've seen good deaths and I've seen bad deaths.
One of the great things about them is that they don't decide what they want from you. They start from what do you want to give? What's important to you? What will make you feel good?
I don't think it is a they and us, it's a we.
I do feel completely part of the broader family.
They've always got time for you, and it's that level of making you feel that you make a difference and that you're important.
Every step of the way I've been impressed with the way NCPC have always said, are you happy with this? What can we do to make it easier? Even little things like, do you want us to arrange your rail travel?
I think they care.
They're an organisation with heart.
I wouldn't be without it.